So now we turn our attention to what you can do to reduce your risk for mosquito and tick-borne diseases here in Minnesota and Wisconsin. Our first guest is an emergency care physician with the urgency room, Dr. Jim Stowell. Thank you for being with us.
Thank you for having me.
Appreciate that. So before we get into some of the more specific types of diseases that we see here from mosquitoes and ticks and things, and perhaps maybe even spiders, I don't know, but what are some of the myths that you hear all the time, and what's the truth to some of these things?
Well, there are a lot of myths out there, and one of the biggest ones is spider bites. A lot of people come into the urgency room and they think they've been bitten by a spider because they see a kind of a red area, swollen, maybe painful, maybe itchy. But that's just not the case. I think spiders get a bad rap. There's only 2 spiders in the United States that cause significant problems, and that's black widow and brown recluse, and neither one of those are native to Minnesota. So actually seeing those in the state is reportable, and spiders are, most of them are docile. They don't feed on humans, not like ticks and mosquitoes, and so they're not going to sneak up on you when you're sleeping and bite you.
They're not.
No, they're not. So they kind of get a bad rap, and most of the people that come into the urgency room with what they think is a spider bite usually is a reaction to an insect, a sting, something along those lines. More commonly, it's a specific bacteria that infects the skin and causes abscesses.
And bee stings too?
Bee stings too can do the same thing. Yep. And so a lot of them, we worry about infection, and we end up seeing a lot of those in the urgency room and draining them because antibiotics don't work very well if it's a collection of pus. And so we have to drain them.
Oh, okay. So here, we've heard a lot in the news lately with Zika virus and a concern, especially if people are traveling to some of the places like Puerto Rico and maybe Central and South America and things. So perhaps there could be some kind of a risk, but what are the things that you most likely see in the urgency room with mosquitoes and tick-borne diseases?
Well, in Minnesota, we worry about West Nile virus for mosquitoes. Some people believe that mosquitoes are drawn to colors, they're drawn to certain foods, they're drawn to certain blood types, and that's not really the case. They're drawn to carbon dioxide, and they're drawn to warmth.
So why is it some people get bit and other people, they can be right next to them and not get bit?
I don't know. It can be scents. It could be something in the sweat. Usually mosquitoes prefer bigger people, large men, and they prefer little children less just because of the mass and because of the carbon dioxide production and because of the heat. But with mosquitoes, we worry about the West Nile virus, and not all mosquitoes are infected. And about 80% of the time, when you do get West Nile virus, it's either there's no symptoms or they're very minor symptoms. About 20% of the cases, you get fever, headache, fatigue, muscle aches, sometimes vomiting and diarrhea.
And those can all be related to a mosquito bite?
Yep, to a mosquito bite, to the West Nile virus. And then about 1% of people end up getting encephalitis. And that's what we really worry about with West Nile virus is encephalitis. So if somebody comes in with fever, severe headache, confusion, weakness on one side of the body or the other, then we get really concerned.
Good advice there. So what about ticks? We have
Yep.
we have Lyme disease here, pretty prevalent in the upper Midwest.
We worry about ticks, and we worry about deer ticks or the black-legged ticks more than deer ticks or dog ticks because they transmit the organism that causes Lyme disease, and about 80% of the time, if you do get a tick bite, and we see a lot of these in the urgency room, we remove ticks, and we can talk about that a little bit later,
Sure.
removing ticks the appropriate way. But about 80% of the cases, if you do have Lyme disease, you're going to end up seeing a rash, and it's a bullseye type rash or a target-looking rash. It starts out as a red raised bump, and it spreads, and then you get central clearing, and it looks like a target or a bullseye, and they can get pretty big. They can get up to grapefruit size or even bigger sometimes. And then, the important thing about Lyme disease is recognizing it early, because if you do, it's easy to treat with antibiotics.
And what would those symptoms be that you would notice?
You get the rash at about, a couple days to a couple of weeks. You'll get this target rash, and that's the easiest time to diagnose.
And that disappears then after?
That'll disappear. Yep, that'll go away. And if it's not recognized, and it only happens in about 80% of the time, the other symptoms are kind of like West Nile virus. I mean, you can get headache, you can get fever, you can get muscle aches. And then if it's not treated, if it's not recognized and treated, you can go on to have arthritis, heart problems. It can affect the nervous system. So Lyme disease is an important thing to recognize and treat, and we do that all the time in the urgency room. We'll remove ticks. If you have any question about what kind of tick, if you come in and you see a tick on yourself and you either can't remove it fully, or you don't want to, or you're worried about it being a deer tick, come into the urgency room and we'll take a look. We'll remove it. We'll update your tetanus. We'll get you on antibiotics if we need to.
So, what is the best way to remove it? If someone can do it, or is it better just to come to the urgency
Well, I
room?
saw you can try it at home. If we do it all the time in the urgency room. I saw a guy one time in the urgency room who used a lighter. He tried to burn the tick off, and the only thing he did was get a second-degree burn on his leg. And so the tick was still alive. It was still attached. It was still feeding on him. So I took it off. But the best way is to use a set of tweezers. There are products out there that will remove the tick that you can buy, but the best way we've found is to use a set of tweezers, grab the tick as close to the skin surface as you can, and then provide gentle upward traction until the tick releases. And don't grab the tick, don't twist the tick, just gentle pressure upwards.
Or come see you.
Or come see us. And there is a myth that you need to remove all of the tick in order to decrease Lyme disease. And the fact is that the tick needs to be on there for about 24 hours, sometimes more, to even transmit the disease. And if you remove most of the tick and you still have the head or parts in the skin, you don't want to do any more damage to the skin. So we'll remove it if it can be easily removed, but we're not going to dig it out, because that can cause more damage to the skin, and we don't want to do that.
And it's probably good to try to prevent getting these to begin with, right?
Yeah, and so prevention's a big thing. So if you're, if you really don't want to be around ticks and mosquitoes, you can stay inside. But in Minnesota, everybody wants to get outside and enjoy the weather.
Sure.
So there are products you can put on that have DEET. Those work the best. And they're safe for kids as long as you apply them like they're directed on the packaging. And wearing long sleeves and long pants and tucking in, the sleeves and the pants. Bigger things, though, are checking yourself when you come in. And making sure there aren't any ticks on there, because like I said before, it takes 24 hours, sometimes longer, for the ticks to actually transmit the disease. And so if you can find them, take a shower, wash them off. If we see ticks all over the place.
I was going to say they're probably all over the body, right? Not specific areas.
Yep. If you can imagine a place on the body, there's been a tick there. And so checking in the shower is important, and making sure that you don't have one there. I have dogs, and they bring ticks into the house
we did too,
all the time, so you need to check your dogs. There are times I'm sitting on the couch and a tick starts crawling up my arm from my dog. So, or when they'll leave, there's a couple ticks on the sofa. It's kind of gross, but it happens. So you just need to be vigilant.
All right, sounds good. Any other final advice about protecting you and your loved ones during this mosquito and tick season here?
Yeah, I think just being aware. If you develop, symptoms that you think are flu-like,
and
it's not
typically flu is not in the summer months.
Exactly.
Yeah.
So it's not influenza season now. So if you're developing symptoms that seem to be flu-like symptoms, it's a good idea to get checked out. And you can come into the urgency room. We'd be happy to see you. And it's about recognizing the risk, minimizing the risk, and then recognizing the problem once it happens.
And the urgency room located at several locations
Yep,
around the Twin Cities?
We're in Eagan, we're in Woodbury, and we're in Vadnais Heights, and we're open 8 a.m. to 10 p.m. And you can see a trained emergency physician and emergency staff.
Like yourself?
Yep, in a clean, efficient environment, and we'd love to see you.
And you can go online to see how long the waiting period is too, I understand.
You can, yep. You can go online and see what the expected wait time is.
Well, great advice. It was a pleasure to meet you. I'm glad
Thank you
to
very
have
much.
with us.
Thanks for having me.
Thank you.